In your MMIs, you're going to have quite a few stations on a lot of different things, and one of the things that is most likely going to come up is the NHS. Many reasons for this, namely because they'll potentially be your future employers, but you do need to know a good deal amount about the NHS. So in today's video, we're going to be doing a mock MMI station. How it's going to work is I'm going to give you 3 questions. I'm going to give you the opportunity to pause the video after each question, maybe take a minute or two to think about your answer, maybe practice delivering your answer. Play the video, and then we'll talk about each question in turn. If that sounds like a good idea to you, let's get straight into the video. Alright, so before we start, just a quick hello. I'm Akshi, I'm a 4th year medical student at Imperial, and I'm in like 4 to 5 of these kind of mock MMI stations, so if you're interested in particularly the ethics side of the MMIs, you can go and click on those as well. They go through 3 to 4 different questions per video, with mock answers assigned so you can use this for your own practice. You can come back to this video anytime you want. Awesome, let's get straight into it. So question number 1, can you describe the current state of the NHS in the UK, including its strengths and weaknesses? Alright, so this is pretty easy, I think, if you've done a decent amount of research on the NHS, which you should be doing, and it really just is asking you for your opinions on the NHS. What's the strengths and the weaknesses? So, no right answer here. A couple of the key things I'd remember is the NHS was founded around 1948 by the Labour Ministry of Health, so not Conservative, even though we've had a lot of Conservatives recently, and his name was Aneurin Bevan. So, he created the NHS in 1948, although I think the general sort of idea was created a couple of years earlier, but 1948 is the official date the NHS was open for business, and a couple of strengths really come down to the 3 principles he founded the NHS upon. Number 1, that it's free at the delivery, so at the point of delivery of the NHS, it's free to everyone. It's assigned based on the needs of care and not pay, so just because you've got more money doesn't mean you get better care. It means instead, if you've got a more difficult condition to deal with, you'll get more care. And also that it's accessible to everyone. So no matter who you are, if you're a registered citizen of the United Kingdom, you have access to the NHS. So it doesn't mean literally anyone, but you do have to be a citizen of the UK. But as long as you are a citizen here, you get free access to the NHS. So that's the key thing. And at its core, that's what makes the NHS so good. The universality of it, the fact that it's free, and it delivers pretty high quality care. You know, in the last few years, the NHS has been rated quite highly amongst world healthcare, despite the negative news it receives in the media. Now, the weaknesses are a lot easier to think about. For example, the sustainability. The NHS was a good idea 100 years ago, but with the aging population, with the increasing population size, with the increasing cancer rates, it's now essentially going past its expiry date. It's not sustainable anymore. Second of all, staff shortages are a real problem. You'll have heard about the junior doctor strikes and consultant strikes and nurse strikes. Staff shortages are a real problem. People don't go into healthcare as much as they do, 5-10 years ago, because pay is really low on the NHS, so people don't get as much money as they should considering the amount of work they do. So that's a big problem. And also long waiting times. We can't now see people as quickly as we used to be able to, because like I said, this all comes down to sustainability. So those are some of the key things you want to cover in that answer. And I'll put like a general summary or mock answer on the screen now. Awesome, let's get into question 2. What measures do you think should be taken to address the funding issues in the NHS? So again, a tricky question. Now, no one's expecting you to come up with something revolutionary that would instantly solve the NHS's funding problem, because you're not the finance minister. But, you should have a few basic ideas that obviously have been thrown around a lot before, but just some ideas that you have. Number 1, really simply, more money should be put into the NHS. Now, you don't need to worry about where this comes from, but just stating that more money needs to be put into the NHS. You can use examples. Around 6 billion was put into the NHS just to cover COVID during the pandemic. So in a similar vein, more money could just be invested into the NHS. But obviously that's not really feasible. Money doesn't grow on trees. So you could also say that maybe alternative funding routes could be created. So we know the NHS is mainly funded by the tax that the general public pays, so the taxpayers, national insurance, which is slightly different from tax, but it's a kind of similar thing that most people pay, and other general charitable donations. So aside from those 3 main points of income, you could suggest some other, sources of income for the NHS. Now, I don't know any off the top of my head, but you don't need to come up with those either. You just need to suggest alternative sources of income. Finally, instead of bringing new money into the NHS, you could suggest more sustainably making the NHS more efficient. So saving up money in potential areas of the NHS that aren't as effective, and freeing it up for areas such as A&E that need more money invested. So these kind of things are some of the ideas you could come up with, and again, I'll leave a summary on the screen so you can take a look at this and come up with your own ideas maybe. But these are 3 things that I think would just about get you some good marks. Cool, let's move on to question 3 now. How has the COVID-19 pandemic impacted the NHS, and what lessons can be learnt from this experience? So this is a really interview-bait question. I mean, like, if no university puts this into their MMI, I'll be shocked. It's such an easy question to throw in, and it tests quite a bit of knowledge from you. So this is something you should definitely prepare for. So let's talk about what the lessons we learnt from the pandemic were. Now, this question can be applied across the world. You know, there were several pandemics and epidemics that happened that tested national healthcare systems, but for us, COVID-19 is the most topical. So number 1, we noticed that the NHS just wasn't built for a pandemic. There were so many stresses on the NHS at the time. 30 million appointments were just missed. Non-COVID care got backlogged 2-3 years even sometimes. And there were just far too many needs that the NHS couldn't fulfill. Staff shortages were rife, conflicting advice from the government was just thrown around, there were pressures from the media, general public, management sectors weren't working with healthcare sectors. So there's so many things that you could mention at this point, but those are some of the general lessons the NHS learned. But what's more important is how the NHS reflects on it, and reflection, you'll remember, is a key theme in the MMI, so you need to reflect on this question. Number 1, you need to emphasize that the NHS needs to be more prepared for pandemics. Now, there are predictions about future pandemics being thrown around. Some people estimate that in the next 10 years we'll face another pandemic. So you need to say the NHS has to learn to be more prepared for pandemics. Working with pandemic projects within the government, there's a national pandemic preparedness program that's being worked on to try and identify barriers that we can sort of knock down to make the NHS more prepared for a future pandemic, which inevitably is going to be a lot worse than COVID-19. Also, flexibility is really important, so making sure the NHS is flexible enough to be able to deal with different scenarios. A pandemic isn't going to be our everyday scenario that the NHS needs to deal with, but it needs to be able to just, with a click of a finger, be able to switch from general day-to-day dealing with cancer, ischemic heart disease, and be able to switch into pandemic mode, where it can churn all of its resources seamlessly into an approach that can deal with a pandemic. And finally, one of the most important things are innovation. The NHS has been known to use old technology for years, and it's not nearly up to date with the modern benefits of technology. You know, if you go to a hospital and do a placement, you'll see that some of the computers the NHS use are from 2005 or 2010. And it's not easy by any means. It's not that the NHS just don't want to use new technology, but there needs to be an emphasis put on innovation. You know, we're getting into an era with AI, things like modern computers, so the NHS needs to be catching up with that. Not only because that's the way the world's going, but also it's going to save the NHS a lot of money using these things. So that's a really good point that you can talk about in the interview. And I again put these all on the screen so you can have a look at them, screenshot them, come back to them later, but that's something that I would say. So question 4, the last question, you're nearly there. How can the NHS improve patient access and reduce waiting times while maintaining a quality of care? So now you've talked about, you know, what the problems are with the NHS, what we learned during the pandemic, and some of the things we need to do. So this question is now asking you to tie all of that together and tell me how we can achieve that whilst maintaining our quality of care. Because at the end of the day, if we sacrifice our care quality just to make ourselves more efficient, it's not by any means a better healthcare program. So what would you do? So again, this isn't really asking for anything innovative, just point out some of the things that have been done already. So number 1, investing in infrastructure, building new hospitals, investing in current hospitals. If you go on the news, there are a lot of hospitals that are being run down and are being underinvested, and as a result are collecting dust and just aren't suitable for patient care anymore. Number 2, things like telemedicine, which is essentially just the use of remote medicine, so online appointments, Zoom/Teams meetings, encouraging the use of virtual hospital care. These kind of things are obviously for the future, but it's really important that you can bring them up because it's likely when you start working that virtual healthcare is going to play a massive role in your career. Not only that, but optimizing scheduling, so whether it's OR room scheduling or patient appointment scheduling, or whether it's discharge scheduling, all of these things need to be optimized super efficiently. So putting more of an emphasis not on just being able to treat patients very quickly, but also optimizing the scheduling we use in hospitals is really important. And finally, referral pathways. Generally, healthcare in the UK is primary care, which is GPs, and community care. secondary care, which is hospitals, tertiary care, which are specialist centres. Now, the main problem we have is between primary and secondary care. This is where we find the most wasted time, the most poorly used resources, the most inefficient communication. In the interview, you want to specifically emphasise that primary care and secondary care need to improve their communication between each other. If you spend time in hospitals, you'll see the number of times GPs are frustrated with consultants and vice versa, because it's just not there, the communication. So really focus on communication in this aspect and talk about primary care and secondary care. How, talking between each other more openly is going to create far better healthcare for the patient involved. And that ultimately, at the end of the day, is what we're doing here, improving patient care. Okay, so again, I'll leave that screen open here. So that's pretty much a summary of question 4. And I'll leave the timestamps down below if you want to go back to any of the questions, any of the answers, you're more than welcome to. Hopefully it's been useful and you sort of run through a little mock MMI station there. I'd recommend if you want to do this again, maybe do it timed and save the sort of talking through an analysis for the end. So you can use the timestamps for that down below. Aside from that, I will see you all in the next video. Make sure to subscribe, share, like the channel, whatever, and post your ideas for more videos down in the comments down below. Or on my Instagram, you can always DM me there as well. Thanks for listening. I'll see you all in the next video.